always had a clear vision of my life. So my journey started when I was as young as 9, and I was involved in a lot of social work. I found myself working with the youth who were lost. Also had opportunity to visit the red light areas and counsel young sex workers. I always had, I fought with low confidence, I guess, for some reason. Though other people found me confident, but I had low self-esteem.
You became the friend that when people were having challenges in your life, they knew they could come and talk to you, they could open up, that you would be the one that would listen without judgment.
Absolutely, the power of listening, so powerful.
My testosterone numbers were lower than they should have been. There was no conversation about, well, hey, let's talk about your diet. Are you eating clean? Like, let's talk about your sleep. Are you getting good night's sleep? Are you exercising? Are you going outside? Are you getting sunlight?
Our body is a beautiful gift. It's a beautiful creation. It has the self-healing mechanism only if we allow.
Today, I am joined here with Dr. Stuti, who is the director and founder of Etsah Trinity, which is the leading research and development for Neuro-Cell Interventions, integrating neuroscience-based healing into mental health, is a Tedx speaker, a mental health consultant, a clinical social worker, Neuro-CBT Specialist, and awardee of the top 100 businesses in India. Dr. Stuti, that is a mouthful of a title here. It is an absolute pleasure to have you joining us on the show today.
Thank you so very much for this generous and kind introduction of mine. I appreciate it. Yeah.
Well, it's a pleasure to have you here. I always like to start by understanding your journey of how you got here. And it takes a real commitment to dedicate your life to helping people with their mental health. And so I'd love it if you could take us back a little bit. How did you get here? What's the story of Dr. Stuti and how you got here?
Well, let me start from way, way, way back. So as a child, somehow, how we are all born with a purpose. So I was always called extraordinary, especially in my abilities to be a listener and
Okay,
to be
that's a good
kind
skill to have.
and to be kind and to be just there, just there, present for someone who is in need. And that, I guess, was a big, huge, strong programming right there. Me, myself, acknowledging it as a child too, that there is something special about me and I was born with a purpose. Right from the start, I always had a clear vision of my life. So my journey started when I was as young as 9, and I was involved in a lot of social work as well, because I grew up in a Christian family. My dad being a minister, I was always involved with the church activities and more so social work activities like, I would just go and be there present for people who would, who would struggle in life, especially at that age for the kids, And as I grew up, I found myself working with the youth, and especially those kind of youth, who were lost. And I also had opportunity to visit the red light areas and counsel at that early age. The time I was in teens, but I would go with some teams and counsel young sex workers. So
Okay,
very unusual,
that's a journey.
very unusual, but these were the kind of social work activities that I did at that age. And as I grew older, I also went through a lot of my own personal experiences, life, like, though I was so much involved with social work, I always had, I fought with low confidence, I guess, for some reason. Though other people found me confident, but I had low self-esteem. And, I guess I was always a chubby child. So I had those kind of issues. So it was right from, at early age, I also went through certain challenges. When I got an opportunity to go to the UK, that's where my personality kicked in. That's where I was thrown into a very different world where I learned a lot. And even while in the UK, in fact, I did my theology and pastoral studies from the UK, and I got a lot of opportunity again over there to work with young people. And while I would repair myself, I also had that opportunity to reach out. So there was a transformation that was happening right from the start, and I came in touch with the mental health field right from the beginning, as I have said. And UK was one journey where I learned a lot, where I was, there were a lot of experiences that I had in UK. In fact, one of the experiences where I went through a breakup and went through depression for 1 full year. I was even
Okay.
prescribed a medication. I went to NHS and I was prescribed a medication. Uh, for some reason, I took it for some days and I decided that I need to really fight this with my ability. And because I have always been spiritual, I decided to be strong in the word and fight what I was dealing with. And depression is real, but depression is also one of the mental states. I learned it myself that certain decisions I took for myself helped me to overcome. And it was progressive. It took 12 months where I took certain decisions of disciplining my emotions, and that's how I overcame. So that was my first journey of fighting it out aloud
Okay.
because I
Okay.
had
But
no
like,
family.
okay. So again, personal experience there, and I like what you were saying too. That from a young age, it sounded like you were kind of the friend. You became the friend that when people were having challenges in your life, they knew they could come and talk to you. They could open up. That you would be the one that would listen without judgment. And did you learn from that experience the power of just actually listening?
Absolutely, the power of listening, so powerful. Power of listening and patience.
Are people generally good listeners?
Some can be because it's a gift. Listening is a gift and doesn't really, I think that it's up to an individual when they realize it that it's a gift. So I was blessed to realize it at a very young age, to be honest.
Hmm.
And this gift developed with time because I was willing. I desired to do so.
Right, because you could feel the importance of it, the significance of it, and wanted to lean into it. I
Absolutely.
am curious too. Again, you talked about from, a young age in your teens working in the red light district as providing counseling services for sex workers there. Again, I just have to ask just because that's such a um, non-typical thing for somebody to say in their life story. How was that experience for you? Is it something that you wanted to do or something that was presented to you? Like, I'm just trying to even understand, like, how does that opportunity even come up?
You can say it was presented, and it was, I guess it was both as well, because as I said, I had clear vision all throughout. And I would enjoy, because we had at that time, since I grew up in a church. So back in the day, I'm talking about, like, I guess in the 80s, late 80s, early 90s, where we had, ministerial teams come, and I was always curious to go along with them. So those opportunities came also, as they were presented to me, like, would you like to accompany us? And I would just go without any fear. I was really fearless. So I would even go to these areas, being very bold at that age. I was very strange. Like, when I think back about it, I feel, if I would I allow my daughter? So yeah.
Right. But at the time, there was something in that was speaking to you. You realize, hey, I can help these people. Was it again? Can you run us through the experience of your first day? You're in the red light district, and what does that
Yeah.
feel like?
So the first day, I went with an intention of helping always. It was always in my heart to be there always. And so with an intention of course, I want to help someone today and I
Hmm.
want to listen to someone's story. And when I went with that intention, it was like, the sex workers we met, and yeah, as young as even like, my age even, and some as old, because you could find the mix in ages. Specifically at that age, where I was just exploring, it was an intentional help, but I also got an opportunity from 2004 to 2000 to work with International Justice Mission, where I worked as a staff, and there that feeling was different. But initially, when it started off, it was like go, explore, help someone without any fear. And just that feeling shifted a little bit when I became a staff, aftercare staff, where we used to
Right.
go on raids and we used to break through with the law enforcement, of course. We didn't go alone.
Okay.
And we would rescue the minor girls from prostitution, those who have been trafficked. So those who were illegally
Traffic. Okay.
trafficked, we would rescue them. So it was a shift from being going to the red light areas at young age and being there doing a ministry work, doing something nice, just listening to them, to their stories, versus also going as a staff to then rescue minor girls and also being present with them.
And were they receptive to being helped?
So when I went there, just as a, just when I wasn't working with IGM, it was, yes, they were receptive because
Okay.
there was no fear for them, because of course, if someone would come and listen and they would just get that time off, from what they would do in
Got
their
it.
regular lives.
Yeah, no, it's just I was just curious because I wasn't sure like how guarded they might be or how defensive or like who are you? Why are you talking to me? So again, very interesting to hear that if you go in with that intention of wanting to help, wanting to listen, and they can feel that energy from you, then they do open up. They're grateful that somebody's actually there to listen to them.
It's acceptance, you see. It's the uh with the attitude of love, grace, and not judgment, not being judgmental about what they are doing.
That's an
So,
important one. Yes.
very important. And that's why they were so receptive and they would welcome. In fact, they would feel good. We would play games with them, with the children. They would love that. And my mom always said that you're such a weirdo
Hmm.
in a good way,
Hmm.
doing weird.
I've certainly been called that a few times in my life.
So, like, even my school friends, then these things, it came natural. I didn't have to make an effort. And then
Hmm.
ultimately, when I really worked with International Justice Mission for those 2 years, life-changing experience again for me. It wasn't new to me, but new in the sense that then I would go with the law enforcement. Now there, the shift was they would be afraid. They would be scared. They would resist me in that case because there would be that kind of barrier that they would feel that their life is at threat because rescuing them means taking them away from the pimps.
Hmm.
And where we would also risk our lives. There were times when I was doing this work, especially with IGM, I would get threats like, and since this kind of work involved a lot of risk as well.
Right.
But I always remained calm in whatever I did. In that sense, I remained confident. The personal issues were different, but in that sense, in where I had to be there present for someone, I was always confident. I never
Do you
doubted.
know do you know where this confidence, this bravery, do you know where that came from? Like were you just always was it just a natural part of who you were? Was it something that you developed growing up? And the reason I'm asking this question is again, there's a lot of people out there in the world, myself included at certain times in my life where I've, been like, wish I was a little, wish I was a little more confident, right? And I know for myself, I've learned that by doing scary things and kind of practicing that, you kind of incrementally build up your confidence over time. But can you take us through like your journey of how did you get this confident that you're like, I'm gonna go on police raids, I'm gonna rescue traffic sex workers, like that's a big deal. So where did that come from?
I guess that was developed with time because there was something happening within me also in my internal world. And that had to be, it was parallelly, whatever I did helped me also shift the internal me. So it was more of development that happened, decision, that I took, intentional decisions, being conscious about the changes that I had to make within me.
Right.
Uh, that was one part. And also, I guess, as I said, I always knew that I have a purpose to my life, I have a vision. And so I guess it is that, drive within a person when they know uh, their vision. You are slowly, steadily exposed to those kind of situations.
Right.
Those situations mirror, I guess,
So I'm curious. So you were telling us you were in the UK for university. I believe you said you were studying
theology.
theological studies. What was then the transition point to getting into, yeah, in terms of studying mental health of that part of the journey?
So that was a spiritual dimension of rediscovering my faith, um, you know, being convinced about it personally and not just being in faith because, for the sake of it, you know.
Hmm.
So that was that part. Mental health was always there. It's a gift, innate gift, ability that was always present. It just had to be fostered. And so after I pursued my BA in theology, and when I returned back to India in 2002 and 2003, it was, I took a year of like, slow year, like kind of sabbatical, you can say.
Yeah, take a little breather. Think about your life.
Breather, because it was like again, I went to the UK when I was like teenager, like 17 and a half maybe, and then I come back as an adult. Then I had to just take a breather to transition back into my culture. And the thing is, I didn't want to come back, to be very honest. It was my
Okay.
mother. And so the culture, like my mother was really worried. And at that time, it was like all about, parents being protective. So they were really worried that I have integrated into the UK culture a lot. And so they just wanted me to be back home, my mom especially. So I had to really come to terms with that reality. And while doing so, it gave me enough time. I always took that opportunity to have a breather, to refocus, to understand what's happening and go with the flow as well. With whatever opportunities came, I never said no to those opportunities. I was always up for growth and development. So the transition then took place when I started working with International Justice Mission, and I did more of youth work where there were a lot of youth who suffered with psychological issues, especially when it came to relationships or when it came to their own self-esteem. Because by then I had learned a lot myself. So I was able to also be there as a youth leader, as a youth mentor. And with IGM, of course, I counseled, I was in an aftercare team. So I got that opportunity to rescue and to counsel these girls and
Okay.
to help them transition from, their one state to, a state where they were more stable. And yeah, so that's how the transition took place then, like in the real sense.
Okay. And so for those of us that don't know, so neuro-CBT, cognitive behavioral therapy, can you just give us an overview of what does that mean?
So it's based on neuroscience. It's neuroscience integrated cognitive behavioral therapy where we are actually understanding brain and its functions because it's not the psychological is linked with brain actually. Like there are five important brain segments which if dysfunctional cause mental disorders. And I read the book by Dr. Amen. And after I did naturopathy, I was more curious about neuropsychiatry type of work. So I read his book and I really loved the way he presented the whole mental health segment. So, with just DSM-5, there are so many disorders, like maybe over 300 that we can find in uh, DSM-5 is a diagnostic manual for mental disorders where, there are whole spectrum of psychological mental
Okay.
disorders. While on the other hand, Dr. Emin just introduced 5 brain segments which are responsible, holding our psychological health. Like, for example, let me say prefrontal cortex. We call it the chief executive officer, right?
Right. Yes, the decision maker.
The decision maker, and that's where the thoughts, that's it's PFC where thoughts are created. So it's that part of the brain, and it manages, it executes, it has an executive function. And so this way I was like more able to relate with people coming to me, and I decided to use Dr. Amen's tool, which is basically 50 questions based on 5 different segments of the brain. That became more
Okay.
easy for me to work with patients of disorders, psychological disorders, and I really found that they were more receptive to that kind of therapy or education than just taking them through talk therapy.
Okay, that was that good segue. That was actually going to be my next question because I think most people, when they think of therapy, when they think of a psychologist, I think we can all picture sitting on the psychologist's couch and opening up and sharing our life story. How is CBT different? Like, can you run us through like what a session would look like, or just how it.
So, for example, for a person coming to me and just, they want to talk about, perhaps the post traumatic, let's take, for instance, a PTSD person coming to
Mm-hmm.
me. So, my first session would, of course, look like it's an ice breaking session where I'm building trust with my client or patient. And there I would like to listen to them, first of all, their part of what's happening with them. And after listening to their part, I would also introduce them to their own understanding of how aware they are of their brain reacting or their body reacting to the situation, to the circumstance, which we normally not don't do it for CBT. CBT, how it works is that where we are listening, and then sometimes it never stops because it's only listening, 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 telling them to change their thoughts, change their or replace their thought. Or we say that, just delete. You can't delete experiences of life, but
Not
you can't.
easily.
Yeah. And but when we tell them of how connected they are with how their brain has responded, how their body has responded,
Mm-hmm.
and what how it would be if there would be a different kind of understanding rather than looking at their experience as, of course it's a trauma, but rather than actually looking at it through a negative lens, how about fostering it, strengthening an extra muscle by using brain, of course, and then the thoughts, right? So
Mm-hmm.
I introduce them slowly to their brain segments. I take their assessment and I tell them, see, this segment does this. This is how you feel. Is this how you feel also in your body? And then they would say it. That's how they become aware. So this is how we start. We make them more aware, more present, and more of like, where we, help them to empower their own, being in touch with themselves, basically. So
Right.
that's, I hope, I'm not complicating it. I hope it's making sense of the difference because let me tell you, when I used to just take purely CBT sessions, they would go on for, I guess I wouldn't even keep the count of sessions. There was no empowerment. And then it was
Okay.
ranting all the time of what had happened, never ended. Versus educating, making them aware, helping them with certain exercises, and giving them a different dimension to a thought analysis, giving them a purpose to look forward to, helping them with how they would want their life to be changed. So there was a drastic difference between the normal CBT and the neuroscience integrated CBT.
Got it. Got it. Okay, so you were able to see some of the, let's say, missing components of the more traditional CBT, and you were
Absolutely.
like, okay, we need to tweak this, give it more of an educational component to actually empower them to
Yes,
be able to take control of their situation.
absolutely.
Okay. Okay. And so is it that, like, it seems to me like you're fascinated by studying the mind. Is that fair to say?
Yeah, fascinated with mind, brain, whatever you want to call it. But yes,
And I'm curious too, because you do have a background in naturopathy, and like I'm very interested in that because to me that says that you likely have, let's say, alternative approaches to how you view healing. And I always try to be careful with these conversations because I don't want to necessarily be negative on Western medicine. I think there's a lot
no,
of
yeah,
elements of it that it does
of
right, but I
course.
also feel like there's a lot of elements that it doesn't do so good. And so I think having an approach of being, like you said before, again, being open minded. Hey, let's try some alternative methodologies here. So I'm curious how that training in your life has then influenced how you view mental health, how you view healing, and the different approaches that you take. Because one of the things you said right up front is, you know, I want to do my best to get people off medication if they don't need to be on medication. Now, if they really do need to be, okay, fine, that happens. But if there's cases where they don't need to be, it sounds like you're trying to get people off and doing alternative healing. So what was it in that spoke to you that said, hey, we can do this better?
It's basically, I've been blessed to network with psychiatrists who shared the same vision as I did. So I guess maybe I manifested such psychiatrist in my life because I couldn't do this also without them. See, conventional medicine, I never am against it, but I don't believe in, person being in, what do you call it, being deprived of a life that they deserve to live because
Hmm.
taking meds and living a life versus a person who you're educating and helping them taper and then showing them a different dimension of life. There are two, this kind of like heaven and earth difference. So I found many psychiatrists would refer some patients to me and I would tell them that, you know, that this supplement may work. And I would ask psychiatrists, like initially I was like, some psychiatrists would be, one of them seniors, of course, where I was, Jaipur, where I had my own clinic. So he was a senior psychiatrist. And at some point he was skeptical as well, because of course,
Hmm.
they have learned a different way of handling psychiatric patients. And when I would tell them that maybe this supplement, there is an alternative supplement, like ginkgo bar for memory, or, melatonin, St. John's wort,
Hmm.
perhaps for depression. So all these names would be foreign to them, right? They wouldn't know. But the good thing, the blessing was where they were open to, you know, perhaps helping some patients with supplemental naturopathy, naturopathy supplements. So
Hmm. Yeah.
I got a chance to help some, and some responded really well. And there were some who had doubts, like, and I always found patients who had a doubt between conventional medicine and supplement, and they, they don't work on that. Then I would like
Okay.
be, either or. So this is how I would use nutritional therapy also. Certain kinds of food, like for example, when people suffer from insomnia, banana tea is something that, was a famous medicine that I would give them. Recommendation, I would say. Naturopathy
Okay.
recommendation. And that would work wonders.
Banana tea.
Banana tea,
And
the peel of banana, it
okay,
has
so
a
you
compound
take the banana peel and then just pour hot water on it, let it
water.
steep for a little bit.
You let the water boil, then you put the banana peel and you put cardamom, you know,
Cardamom. Okay, yeah.
one clove just for the taste, and the cinnamon, and you sip it like slowly before
Hmm.
half an hour before going to bed, and it will induce melatonin naturally. in your body, and many patients responded to it. So also part of it also was placebo with my words, I guess, and of course
Placebo effect is
we have
real, but given the opportunity, I'd rather banana peels give me the placebo effect than some medication if I don't need it.
medication, of course. And it it worked wonders on some patients, while I would also be honest, some patients would not be
Hmm.
receptive to it. But definitely, as I went along, I introduced other modalities like, like what do you call it? Food, natural food rather than supplements, exercises, certain exercises,
Hmm.
especially the breath work, and that would do wonders for patients of anxiety, for patients of depression, visual work, like I did a lot of visual work, and I would create sound therapies as well as part of natural modality for those struggling with depression or anxiety, or people with focus or concentration issues. It really worked wonders with all of them. They would give me great feedback on all these therapies. So that's how I slowly integrated natural therapies, and these were mostly ice therapy sometimes, like
Like an
so
ice bath.
ice bath. Exactly.
Yeah,
I would
yeah,
tell cold
yeah. I
showers.
love those. Yeah. No, I really love these kinds of conversations because again, on a personal note, right? Like I have a similar story that I don't know, five years or so ago, I went to my doctor and I just told him, hey, I'm feeling tired, I'm feeling sluggish, kind of low energy, and he ran some basic blood tests, but he basically his first knee-jerk reaction was just to say, hey, there's some really new exciting SSRIs, like we could talk about putting you on this. And I really didn't like that was kind of the first place he went, because it actually turned out that it was, a hormonal issue, like my testosterone numbers were lower than they should have been. And so, there was no conversation about, well, hey, let's talk about your diet. Are you eating clean? Like, let's talk about your sleep. Are you getting good night's sleep? Are you exercising? Are you going outside? Are you getting sunlight? Are
Yeah.
you are you moving your body, right? Those kind of what I would consider to be like basic foundational things, right? Let's start with the basics, the simple things. And then beyond that, too, okay, what kind of supplements are there out there for enhancing testosterone, right? Like
Yeah.
there are a few of them, for example, like Tonkat Ali, maca powder, ashwagandha, things like this are,
Ashwagandha.
yeah, yeah, have been shown to help to balance and improve hormone levels, right? And since I started doing those kinds of things and living a cleaner life, I've been feeling a lot better. No, like there's still ups and downs. I'm not saying that
Of
everything's
course.
perfect and I've finished my journey here. All of those things to me felt like much more, I was gonna say intuitive, but felt much more like just living a good, healthy life of a healthy person. Right? Of like, go outside, go for walks, get a good night's sleep. Don't have too much, alcohol at night. Don't have too much, blue light screen time before bed, right? Like, let's talk about the basics and get that right instead of just this knee jerk reaction to say,
Absolutely.
I've got an antidepressant for you. This will fix everything.
Exactly. This is what I always train, not only myself, but also to others, is our body is a beautiful gift. It's a beautiful creation. It has the self-healing mechanism only if we allow. And of course, when we talk about mental health, of course it's real, but it all depends on the attitude that we have. Because according to me personally, 100% of our population, we suffer in our phases of life. Some go through depression, anxiety, personality disorder, whatnot, But then it's all about attitude of how we want to strengthen that. I feel whenever someone is hit with depression or anxiety, it's not a sign of weakness. It's a sign of growth. It's a sign of development. It's a sign of internal work, something where we get an opportunity. And it's all about holistic, as you said. Basic is starting from understanding that it's all right, it's okay. And it's the approach that we would have, by adding elements and segments to it. So yeah.
And what about, okay, so you've got the training now. I'm always curious to hear people's story too in terms of like transitioning into having a business, right? Because it's all well and good to, go to school to learn the academics of it. How was that transition for you in terms of becoming a business owner, running a business and having clients? Was that a smooth transition, challenging one?
Very challenging.
Yeah.
But be very, yeah, very challenging. I started off in Jaipur, north of India, my first clinic, and I would say that there were days I would just be there, but then started with one patient, and then slowly it increased with time. Like, as people came to know me, I never advertised and marketed, basically.
Okay. So you were saying you were starting to grow your business,
Yeah, so it all started
not
slowly, steadily. Never advertised for it, never marketed. I only had my Google, Google listing, and in no time it started growing. And it was all through mouth publicity. And of course, I would have referrals from psychiatrists. Slowly they came to know about me. And as I said, how when you have a clear vision, everything starts, it falls into place, and it's by default, I guess. It's all about my internal world of expectation from myself as a practitioner, my confidence as a practitioner, and things get aligned. Right people, patients who really need my expertise would come to me. This is what happened to me all throughout. I was even blessed because I the kind of people who came to me were officers, like government officers, their wives.
okay.
And I would feel blessed. I'm like, you know this is just grace that's happening. And no, nothing, no advertisement. It was purely like, just word of mouth.
Okay. I feel like that's the dream for business owners is to have fully word of mouth that you show up, you do good work, you build a reputation, and then people show up and they come into your world. So I'm very happy for you that that worked out well for you. I know for
Absolutely.
myself, I've seen and been involved with a few different business projects where that was not the case. And so again, I think it speaks to your authenticity, right? And you working from your heart and just saying, I'm gonna show up and do the best I can to help people. And people feel that.
I would also be very honest, Arthur. Life is never a bed of roses, right? So, business, as you start any kind of business organization, there were times when, there were times where I would be compelled. Is it working? Do I need to shut it down? Thankfully, I never acted on emotions, like the negative emotions. Never did. I have always thrived, rather. I picked up myself even in moments where I felt low and down when things did not work as I expected them to. And because I was open to learning, I was open to failing, but I was also open to getting myself up from whatever the situation and, go back to driving, being the CEO of my life rather than situation telling me you can't do it. I never allowed that, I never allowed myself to come to that point where I would give up on things. If I started something, I would be like headstrong no matter what. I want to keep going till the finish line. Yeah.
What were some of the unexpected challenges that came up after starting your business?
The initial challenges, like, so there was one time when I was so much like a naturopathy fanatic that I was like so determined. I had a patient coming to me taking like, I don't know, 10, 12 drugs. And I was like, this guy who is only 27 years old is given this, prescribed this medicine. And then I told him, like, I was aggressively, like, at that time, a fanatic, naturopathy fanatic. And I would say this, you should never do this. So I never took consultation of psychiatrist, and I'm like, I told him, you just stop this meds and I'll give you supplements and I'll give you nutritional therapy. So you should never do that as a practitioner. This I learned a hard way.
Mm-hmm.
So when
Okay.
this guy stopped and started taking supplements in the initial 1 month, it was all good. And I was feeling, oh wow, it's great, it's working. But then the relapse started, because psychiatric medications, if they stop is if they are stopped abruptly, they can have those adverse effects. And so I was, thankfully I helped him bounce back. But yeah, they did have, like, that was a biggest challenge because I felt like a failure at that point. What did I do to this patient? Or why would I do this? Like, started, like, because I was feeling bad, like, how can I be so irresponsible?
Mm.
Because there was relapse, and the relapse is very heavy when without the intervention of psychiatrist, when one uses their own wisdom too much. So then I decided, I humbled myself and I said, no, nothing doing. That was the biggest blow, and it's good that I learned quite fast. One of the biggest challenges, because the psychiatrist told me off as well, because it was
Mm.
like spoiling the case. So the psychiatrist called me and they trusted me, but they showed their aggression that I shouldn't have taken such a, that was one of the biggest this thing in my, I would never forget what happened, and that was the first year.
Remember that lesson?
A big lesson. There were many, and after that, there were few lessons here and there where I learned, like, even balancing emotional boundaries, because I've always been a giver. Then I had to, and in my practice, I have never been that professional practitioner, because I feel it really closes a person. So I do draw the boundaries, but sometimes in the initial years, so initial, my emotions would swell up. Like,
Okay. Okay.
I learned I had to have boundaries emotionally as well to whoever came and saw me. So yeah, so some lessons here and there, big ones and small ones. Yeah,
And you keep going.
keep going.
I'm curious because I know there's a lot of talk right now in, here we are 2026 that mental health issues are, exploding. They're all over the place. You know, uh, whatever. The kids these days are a mess. And I'm just curious, from your point of view, is that true? Is that what you're seeing? Is it overblown? Like, would you be able to describe like the general mental health and state of people right now? Are we doing okay?
I'll be very honest. We are not just, let me put it this way. We are not accepting the truth. Accepting the truth, what I mean by that is we are putting a lot of significance on how bad mental health is. Then, giving it a chance, like giving it a very different attitude. Like, yes, it is real. People do get depressed, of course, when, brain chemicals are not working right, with whatever the reasons. A person will feel off. It's all about, accepting that it's okay to feel this way. It's We are trying to run away from the reality, this is what I feel. And also, we are not ready to basically shift from what we know to what is there,
Right?
because what we know is fear. There's fear now, and that's the reason why there is stigma. That's why people are skeptical of going to a professional and, being themselves. So it's all about, understanding that, okay, uh, this is what it is. But rather than hyping it to be negative, how about transforming me myself? If something is happening, something, is not right with my emotions, I'm given an opportunity to understand my emotions and to foster them and to give them a different direction. So that way we are not running away from even a negative emotion, but we are learning to be resilient. We are learning to foster it, and we are learning, becoming aware on how we can actually shift from using that emotion repeatedly to changing it to something positive.
Okay. Okay. I like that. I like that spin as seeing it as a positive. I mean, there's definitely more acceptance now of
Yeah,
having these kinds of conversations, which was definitely not true in the past. And so I
yeah.
also wonder too, like how much is it that mental health has, let's say, gotten worse versus we're actually talking about these things now, and in the past you kind of had to, pretend or bury it or act like everything was okay, and it's now okay to say that things aren't okay.
I keep wondering, the more now it's become open, so the more people try to use words such as I am depressed and that's over the board now.
Mm-hmm.
I am anxious. That's like negatively affirming something, like you're using it so commonly now. So, it's the extreme now, is the extreme where we were ignorant and now we know, but we are using it so much as a daily practice. Words have power. And this is what we also learn in neuroscience. They have a great
Mm-hmm.
impact. Whatever you speak for yourself does impact, it completely changes your neural pathways that, inside your brain, even in the body, the whole chemicals, they change. So now I think it's extreme. It's more taken lean, I guess. I would not say more taken leniently. That's not right to say, but I guess you know what I'm trying to say, right? Now it's like, they just take it for a toss, rather than saying, I guess, now in the current trend, that's why I say it's all about helping yourself to transform, shifting, you know, because depression, anxiety, these are all states. These are all, they happen because of various factors. There can be many factors that are responsible, but the common thing is it's your sympathetic system, or it's your, what do you call it, the mode of survival that
Right.
is the trigger point, which leads then when it's on repetitive mode and when you're not aware, then it can lead to disorders. And disorders can be multiple. One person can have many disorders, if to say, and that would scare them. What if I have a patient who comes to me and I say, oh, you have this. I never tag my patients, never do. I never say, so this is your diagnosis.
Okay.
I work with them, I sit with them, and I say, let's work this out. So this is how you feel, but this is how you want to feel. So let's have a journey together.
Right, because are you saying in that then that there's a dark side then of labeling somebody as having something? Like if the doctor says you have depression or you are depressed, right? And they take that on and they say I am depressed, then they connect with it and suddenly it becomes part of who they are. So how do you, like you said, words have, so how do you linguistically, like how do you frame things differently so they're not identifying with the
So we neuroprogram them. Neuroprogram is where firstly we teach them how what's the impact of words on their life. And it's kind of like showing them the mirror. So if they narrate something to us, for example, how they repeat their stories of trauma, and then I ask them, so you have repeated this like 5 6 times now in different sessions. How have you felt? So then they would say, while we sit here, we feel good, but when we go back home, they feel worse, maybe because then they get triggered by what they have said,
Okay.
you know. And then I would say, now let's change that story. Then let's change the whole, the way you have looked at this thing. Let's change it and let's change your words. So rather than saying that, okay, I feel this and this, what if you start to say that I am working towards, though I feel this, but I am working towards getting better, feeling happier,
Okay. Yep.
you know? And then I tell them to do that exercise. And then it's a repetition, because you see, your brain understands the language of repetition. So the more you repeat, your emotions repeat. So the more your emotions are elevated, your brain sends those signals, the neurosignals, the pathways it creates, and you feel calm. And when it becomes that repetition of where you are, changing and transforming your words, then it also becomes, for them, it becomes, yes, now I understand and it's okay. So many of them, in fact, gave me a feedback. And it happens subtly, honestly, Arthur. I never had to take an effort. I just educate them,
Yeah.
and then they come to me and say, you changed our life. And it's like, "Oh, I used to say this, I used to repeat this, but I stopped saying this and I started saying this, and it's changed my life." And this would, it would be like, you cannot imagine the feeling I would have at that moment. So this would be then a blessing for me when that would happen, where I would help them, you know, transform their words to more of affirmative words, even with no matter what situation they went through.
Right. Like that, I like that reframe there of putting it in terms of let's focus on the journey here of where it is that you're working to get to the end state of how it is that you want to feel, and let's focus on the direction of where you're going instead of being basically stuck in the past
Absolutely.
and connecting with the negative. Okay, I like that.
Can I also share something? So I tell them to rewrite their story. Okay.
Mm-hmm.
So you know how in CBT also you have to write diary, but this is like a different because it's neuroscience integrated. So I say, okay, this is a story you narrated. How would you like? I would say, can you add elements to this story and rewrite it for yourself? After I have made them aware, and you wouldn't believe they would have completely that would have that would be a different version of how they started off with. So these exercises would then help their brain also to settle down and to understand, to become more resilient, rather, to become immune to situations, because we can't run away from situations and we can't run away from what's going to be. But when we live in the present moment and also the gratitude of being able to experience what we did, though they may not be pleasant experiences, but the opportunity that one gets to learn from the negative experiences, when you help them understand that, then it's a whole new dimension to that person's life. That story completely changes for them and they see it
Okay.
with a different light.
Do you find too, are there certain ways that speak to the brain better, and maybe certain people, certain personalities are different, but what I'm thinking of in terms of like if I was to write that down to say, hey, this is the journey that I'm on, this is what I'm working towards getting there, right? So writing it would be one modality. Another one would just be for me to speak the words out loud. I could also see a world where maybe I get out the recorder on my phone, I record the words
Yeah.
into my phone, and then I
And
listen to
listen.
them back. What kind of modalities do you find speak to the brain best, or is it a mix of all of them? Does it depend on the person?
Depends on the person, receptivity of a person. So for one, writing may be, a great way of talking to the brain. For other, it could be, just closing eyes and, I take them through visualization exercises. So some visualization exercises where they would be completely in that, a whole new dimension. Some some would respond to that. Some would respond to even I would do balloon therapy as well. Balloon therapy is
I am not familiar with that. Please enlighten us.
so balloon therapy is like writing. So writing your story down of what you want to be. Okay, from going from one type of person to a different type of person, and putting that the whole pieces into a balloon, blowing it up and putting it in the balloon. Sometimes air balloon works, but I tell them any balloon and then let it go in the air. Let it go in the air. It's the whole thing of, the psychological action, the action that the person does. It connects with the brain. It helps them to be receiving more of, transforming themselves or their mind or their thoughts rather, you know.
Okay, so as a way of like letting things go.
Yeah. And ice therapy, holding ice, do you know about that? Just melting away the pain and embracing something new.
I know I've done ice baths and ice showers.
Ice showers and ice baths are great, but there's one way. So, so I tell them to hold ice, the pain, okay? Because when you hold the ice, you feel so
It gets
intense,
cold.
very cold. It's intense. You can't hold it, right? But then as it melts, it's the whole programming of everything that is old is getting melted away. I'm ready to embrace what I am to be, what
Hmm.
I am to become, And it just doesn't happen once. It's a progressive thing. So sometimes I mix here and there ice therapy with balloon therapy. It depends. All happens subtly. So I don't keep anything fixed. It just goes with the flow.
Right. So I'm curious then. So for anybody who feels, because there's a lot of people out there who maybe feel like they should go to some kind of mental health counseling, but maybe they haven't done it yet. They don't know how to get started. They don't know if their situation is like, I don't know, extreme enough. They're like, well, maybe I feel a little down, but like I'm not one of those depressed people, so I don't need to see a therapist. I guess my question is for anybody who's never experienced this before, they're on the fence. What would you say as a
Practice.
decision point to say, okay, you know what? Actually, I am going to make this a priority. This is something that I want to work on. I'm going to go find somebody that can.
So that's what I'm teaching people. If you look at it this way, that, you're going to get therapeutic advice, you will never go and see someone. But what if you are wanting, see, you know how academics work. When we need a tutor, we would go find a tutor, right? When we are
Hmm.
struggling with a subject, correct?
Hmm.
We would not be
Yep.
shy. We would not shy away from it. So, how about, when people look at it this way, I want to learn more about me, my brain, my body, my soul, how it works. And I'm ready to go see someone who would help me, mentor me, and walk with me in this journey. Because, that would completely change the, perspective that they have, rather than, because then they would be open, I guess. And that's what I've been teaching people, and they are more open. Rather, they come to me without being shy. We want to learn more, we want to understand more, because people hardly know themselves. When I ask them, what do you know about yourself? They hardly know about themselves, They actually, when I tell them to write do a SWOT analysis, strengths, weaknesses, what are the threats
Hmm.
they find for themselves or opportunities that they have. So they don't know. And so if they look at it as a mentorship rather than seeing it as a way of where they they would be sharing their secrets with someone, I think they would be more, more willing to see a professional. And I think professionals should also be of the same attitude. Today, I do know many professionals who have that kind of attitude, but there are also many who sit with their ego. I know everything. And, yeah, and that will shoo away. Like, that would not be, I always learn me, I want to be a magnet, natural magnet to those who are really struggling, that I don't need to go
Hmm.
to them. They would come to me naturally. And so I make myself present and be that person where people come to me. And this has worked with me. Being in this field as a professional, it has worked wonders with me. So I never let them feel that way, that, you know, I'm going to sit here, judge them, and diagnose them, and then give them a roadmap. No. So that's,
Yeah. Yeah.
yeah, I guess, I hope I have answered this right.
Well, I wanted to say here, Dr. Stuti, I mean, I know we've just been, talking for an hour here, which, by the way, this hour has flown by very quickly. But in that time, I've gotten the sense from you. Again, you're a very authentic person. You're a very genuine person. I can tell that you have a big heart, that you really do care about people, that you want to help people, and that energy does off of you. I feel actually very very calm here talking with you
Thanks.
and having this conversation, because it does feel very very natural, right? We're just sitting here and talking about these things. And so yes, that energy does radiate off of you. So whatever
Thank
you've
you.
cultivated there, congratulations.
Thank you, Arthur. You've been so kind, kind words, and I really appreciate. I am grateful for this opportunity and grateful that we met, grateful that I could share whatever I could. I've used my soul here, heart here to, to say whatever came to me. And once again, I am grateful to you. Thank you so much.
It's been an absolute pleasure. For anybody who wants to find out more about you or to work with you, where can people find you?
So even if you Google me up, I'm there up on the Google, but easy way, professional way is to go on LinkedIn, where you can find me very easily. You can DM me if you need any kind of help, if whatever I said resonated with you, and if you need that kind of mentorship, I'm always open, always willing. Yeah.
Fantastic. I will include the links to your LinkedIn in the show notes below, so people can find you and look you up. But Dr. Stuti, like I said, this has been an absolute pleasure having this conversation, getting to meet you today, and get to go deep on these topics here. Before we wrap up, any last thoughts that you'd like to close out for today?
Yes, I would like to say that yes, life isn't rosy, but it's your attitude that can make life worth living. So I would say take every minute to embrace your life and be grateful for the wonderful life that you have and for the breath of life that is within you. Yep.
To remember to enjoy life.
Absolutely. Yes.
Fantastic. Dr. Stuti, thank
Thank
you very
you.
much.
Thank
Look
you.
forward to hearing more about your journey and keeping in touch.
Thanks, Arthur. Take care. A lot of blessings. Bye. Have a
Fantastic.
great day.
Thank